Hey, good morning, everybody, and welcome to our summer release webinar. So we're looking forward to showing you some of the exciting enhancements we've released over the latest set of builds. Just as a quick note, in terms of timings today, we are expected to run to around the hour. It might go slightly over, just so people know, but we will be releasing it to our Street TV YouTube channel. So if you do miss anything, you can catch up with anything from there in the next few weeks. So in terms of what we're running through today, we're looking at builds 869 to 875. So 869 was released in March and 875 has just been released in July. Just before we get started, there's a few housekeeping bits to have a run through. So today's webinar is being recorded, as we've kind of alluded to. So that's just so we can put it on the YouTube in a couple of weeks' time so people can rewatch it for any parts they might need to. We have set everybody's cameras and microphones to be switched off. We do ask that you keep to this throughout the event. In terms of any questions you might have and things like that, we've got a dedicated Q&A facility within the Teams. You will see at the top of your Teams bar, there should just be a little Q&A panel that you can choose. If you go into that, we have got somebody monitoring the Q&A, so feel free to ask questions in that during the webinar. So just to introduce you to who we've got presenting today and the sort of things we're going to be running through. So my name's Mark, I'm the Customer Success Manager at Street TV. I'm just going to be running you through some of the general system updates and some of the kind of PHIN compliance today. I've also got my colleague Jacob joining me, so he's our customer accounts assistant. He's going to be looking at the kind of automated rules updates and also the Compucare patient portal enhancements that we've released as well. Jonah's joining me. He's a senior customer account executive at Street, so he's going to be looking at some of the orders improvements in the system as well as the improved pharmacy functionality as well. And we've also got Imogen with us in the background. So Imogen's going to be looking after the Q&A section. So as I mentioned, please feel free to put your questions in there and Imogen will come back to you. So to get us started, I'm just going to run through the first set of general improvements. So the first one's just around PHIN. So we did mention this in the last webinar, but I thought it was worth bringing up again just because we've had the 870 build come out since then. So from July, PHIN have made changes to PHIN reporting. We have made the following kind of data extract changes just to assist you guys with this. So the first one is available in 867. So what this allows for is it just allows for an empty file for adverse events. So as you still want to submit something, even though there hasn't been any adverse events, this just means that it makes that process a little bit easier. So we've released that in 867. In 868, so the PHIN Admitted Patient Care Specification version 4.01 now has updated fields in it. So in build 868, we've altered the APC specification through the Data Extracts app just to cater for this change. So just to give you an idea of what this includes, it's things such as version numbers, postcodes, and updated diagnostic fields in there as well. So you can get access to all of those in version 868. And version 870, as we mentioned, which has just come out. So PHIN are also adding a new procedure specification for providers doing more complicated work. So I imagine this won't affect many sites, but it is something worth being aware of, that if there's kind of more complicated work where the surgeon is different from the consultant in charge of the episode, or if there's multiple surgeons involved, the new spec has been updated in version 870. So it's worth being aware of that as well. The next thing I just wanted to talk through was an update of our report generator tool. So as of 880, we'll no longer be updating or distributing the files for the desktop legacy report generator version. So this will be around mid-October. So we do have a new Azure web application which will be maintained and updated. So what this means, just to give a kind of a bit of context to this, any facilities who are kind of using Compucare 8 and looking to do work such as server moves or version upgrades, for example, where reinstallation of the files would be required, your IT teams would need to provide the files themselves for the latest RepGen released before 880. So it won't be included in the version upgrade file packages that you'll receive. So if they don't have access to these files, we would need to move you on to the new web-based Azure environment from that point. It's worth noting that this also means that from 879 in the kind of desktop version, we won't be updating any reporting templates. So if anybody uses things such as kind of the RTT clock reporting or any important reports like that, if a change is released or any changes are required after this version, we'll likely no longer be releasing those from October. So this is the reason we're doing this. This is one of the first steps in moving our application suite to Azure. It's also worth noting that the report generator desktop version will become end of life altogether. So that will be in March 2026. This just coincides with our Compucare 7 end of life date. So clients can now move on to a new Azure web-based report generator. This comes with numerous benefits, including kind of enhanced security, automatic updates, and failover resilience, with reports being automatically cleared down every 90 days. So it just ensures that it's a clean, up-to-date system as well. I've just got a few screenshots on the screen here just to give you a bit of an idea of how the new report generator looks. So it is a web-based tool, and as you can see there, you do have access to all the reports like you normally would, and reports load to screen in the web-based tool. You can still do things such as downloading and scheduling, so all that functionality is still available. So over the next month or so, we will be releasing a demo to the Street TV YouTube channel, which walks through the new model in a bit more detail, including how it kind of looks and feels. So please watch this space for kind of marketing information and that demonstration. For any customers that want to talk through the new rep gen, if you get in touch with our commercials team, we can walk through the new model that way as well. So moving on, the next piece I wanted to look at was kind of outpatient contracts. So for this piece of functionality, on a follow-up booking for a patient, currently the contract will default to the contract used in the initial consultation. So this was introduced just to reduce clicks for users and try and automate some of the bookings team's tasks in the system. We've now introduced an update to this functionality where in the ledger settings in your Compucare system, there's now a new toggle, which you'll see at the bottom of the screen. This just auto-populates the last outpatient contract. So if you toggle that off, it's not going to do that and it requires manual input. An example of where this is likely to be helpful for hospitals and PPUs would be where a patient sees a general outpatient clinician for their initial consultation, and as part of that follow-up booking then is referred to a specialist. So for the specialist consultation, you're likely to want to have a different contract applied. So this just helps with that piece of work of reducing errors. So if the episode of care does have a default purchaser against it, this will still be populated, but the contract itself will not populate. So this change is also only for outpatient bookings. So this piece of functionality is released in the 872 build. So moving on, the next thing I just wanted to talk about was provider payment runs. So when making a provider payment run, we received feedback that usually facilities would not always want to pay a provider all of their fees on an individual payment run. So whilst it was already possible to remove certain payments from each provider's payment run, each individual line had to be removed, which we appreciate was kind of time consuming for billing users in the system. So we've now introduced a new multi-select option. So where users should be, as you can see on the screen here, users can select multiple payments in the provider's run and remove all of these at the same time. This should just help reduce some of that admin time for the billing users. You will notice that you can go across multiple providers to remove multiple lines at once, so it does work that way as well. This is released in the 874 build. Another new enhancement we've got is around network diagnostics. So in 873, we've released a new network diagnostics feature. This is added to your Compucare systems. So this will just help identify root cause of issues in the system, particularly in areas such as kind of slowness and things like that. So for clients who are locally hosting or in our data center offering, you'll be able to see the network diagnostics relating to the database in the top section that you can see on the screen. For our Azure clients, you'll also see an additional section for Street TV endpoints. This just shows the connectivity to our authentication services as well. Both of these sections should just help end users see how stable their database connection is, and it looks at things such as Wi-Fi connectivity and things like that. So users can manually run a test via the Get Help button, which is what you're seeing on the screens at the moment. The diagnostics do run automatically every 2 minutes in the Compucare system as well, though. So these stats will usually be quite up to date. If a user's connectivity is reduced, you'll see at the bottom of the screen there, it will just show them a message that lets them know that it's poor and may affect performance. So this will disappear again once connectivity increases. So there is also, in certain areas of the system, there's diagnostics against latency. So in the above example, you could just see when searching for a purchaser, it lets the user know whether the latency is good or not. Again, this may hint to where the system slowness might be coming from. So the next one is around our Docman Connect solution. So in the 871 build, we've extended the capabilities of the Docman integration in Compucare. So this is an app which helps send discharge information into referrer mailboxes via mesh. It just ensures kind of secure communication. Previously, we added the ability in Docman to send over correspondence to GPs. This just ensured that letters could be sent over with the Docman submissions app and they're going to get to the right place. So we've now extended this to allow for additional attachments to be sent as well. So these attachments will pull from the attachments app in Compucare. One case study for this might be around lab results, which is the example I've put on the screen there. This would be useful for the GP to see, as well as the kind of cover letter and any discharge information. They can also see any lab results as well. It's important to note that currently each of these attachments will send us individual messages. And in terms of how they show in Compucare, they'll all show under the correspondence, and it'll have a little drop down and extra column just to let you know what's been sent in that Docman submission. So once the submission has gone through Docman, it will show in the correspondence app as usual. The additional column, as we just spoke about, that will just show you any additional attachments in there. I just wanted to move on to the notifications. So this is the last thing I'm going to talk about before I move on to Jonah's demo piece. So this is something that's coming out in 876, which will be released later this month. But I just wanted to draw attention to it in today's webinar because it is quite an important piece of work. So for those who haven't seen it already, in 863 we brought out a new release which meant that any notifications sent to a patient are now sent to both their email and SMS if both are completed against the patient record and the system has SMS and email capabilities. So this was just to ensure we kept up with best practice and used all patient communication channels to notify them of any activity around their health records. So this new development, which will be coming out in 876, it will just give users a little bit more customizability around what specific templates for each notification type they can set. This will also kind of extend as well into things such as automated rules and other areas of the system, which will just give users the ability per automated rule to select whether they want to send an email to the patient, an SMS, or both. So hoping with this development, it will just ensure that notifications sent from Compucare are professional, kind of concise and formatted correctly as well, but also give users just that extra customization which we've had feedback around. So when this release is complete, there will be a video released on our release note website, so you should be able to see this in action on there. So that's everything I wanted to run through on our general improvements. I'm now going to hand you over to Jonah, who's just going to run through the first section of our live demo today.
Thanks, Mark, and good morning all. So I'm going to walk you through some of the key changes we've made to Compucare 8's pharmacy, orders, and outpatient modules. So I've been working with our clients to improve Compucare's features and behaviors in these areas so that further digital efficiencies can be made through the system. Now, I wanted to start off with the pharmacy module user stories, and if you do have any questions as I go along, please feel free to use the live Q&A. So to begin with, I wanted to demonstrate a small addition to the persons area of the system. In the person record, you now have the option to either digitally record or upload a signature for your individual. In this case, our clinician, Dr. Annandale. You can see I've got a little squiggle stored in here, which I can happily redo, or alternatively, I can upload a better looking copy of my signature in here. Now, if I save that, I can show you the primary purpose of this change if I switch over to our prescriptions app. So we've made this addition because depending on the policy in place, requested prescriptions from clinicians using Compucare's pharmacy module may be rejected if there's no signature on the prescription. Similarly, there may be circumstance where the patient is taking that prescription externally. So having it signed with other details like our clinician's designation and their name will help that external pharmacy to process the prescription quickly. So in the case of our patient's prescription here on screen, you can see it's been made by prescribing clinician Dr. Annandale. during an appointment, the pharmacy may reject it if it hasn't been signed by Dr. Arundel. Now, if I go to print prescription from the top menu, Compucare is going to go ahead and load my template. And if I just show you that there on the screen, you can see the signature at the bottom there, as well as the name of the prescriber and his designation. Now, you can, of course, get this clinician to sign this by hand, but in terms of digital efficiency, our signature stored on the person record can now come into play on our prescription templates. Now, the next addition I wanted to talk about also relates to our prescription for our patient here. What we've done is we've made it so that when you're printing out a prescription for a patient, you now have the option to email it straight to the pharmacy, templated accordingly, even with our clinician's signature. Previously, it wasn't possible to quickly email a prescription to a specific email address without having to manually type it in each time. And you'll see here on the right, we've got pharmacy@streetsheverhospital.com automatically filling itself in for us. Now, if you're utilizing another system for pharmacy dispensing and not Compucare, then this feature is going to assist in getting that prescription to the pharmacy system in a quick and easy manner. Now, that change has been driven by one of our code tables. So the locations code table, I will show you main hospital reception. In here, we now have a new field called default pharmacy email. This is going to pull itself across into our prescriptions app when we print our prescription. Now, if I can start there, I can show you how Compucare is defaulting that behavior. So it's defaulting it specifically from the location of the signed in user. So under my initials from the bottom left, under location, you can see I'm set to main hospital reception. If I switch to something else, like microbiology, for example, and then redo my print function at the top, Compucare is still going to allow me to email it out, but it will revert back to the default behavior of emailing the patient. You'll see that pharmacy email has not populated itself in. That's simply because microbiology doesn't have a default pharmacy email in it. Now, still sticking with our pharmacy module for this next user, we have a whole new app in Compucare called Dispense, which you can see at the top left here, which has been attached to our pharmacy module. Now, this app is effectively a streamlined version of our prescriptions app that we've made with your pharmacist in mind. And it offers a quick and convenient way to fill in new prescriptions and dispense medication to your patients. Now, we've, of course, designed this app to be familiar with filters on the left, our menu at the top to create a new prescription and dispense, and do things like print and view, and, of course, our grid in the middle and our reading pane on the right. Now, the best part about this app in particular is in the new prescription option at the top. This is going to allow us to fill in a new walk-in prescription. In here, we have a field to select our patient. We can select our prescribing clinician. We get the date of prescription, which will default into today's date. And on the right there, we have an option to drag and drop a copy of our prescription. And Compucare will go ahead and store that according to the defaults we've set in our system settings. In this case, it's going to store itself in the prescriptions folder against our patient. Below that, we have our individual pharmacy items that we want to dispense according to the prescription we've just attached. Now, if I use the new function here, it'll load a new screen, which is effectively a simplified version of our add prescribed items screen. And it's going to let us fill out items that we're going to be dispensing, as well as the quantity, dosage, advisory, and notes. So if I select something like amitriptyline, Compucare is going to go ahead and pull through a lot of detail for us from our charge master record for this item. So it's pulled through a quantity of 28, dosage description, patient advisory description. And you'll note on the right, it's pulled through things like our prescriber cautions, side effects. If I scroll down, contraindications as well. And at the very top, you'll see it's clashing with our allergies for our patient being allergic to amitriptyline. Now, because of that, we do get that alert override reason, which we can find elsewhere in the system, which is just basically a way for us to fill out why we're happy that this item can be dispensed to the patient. Now, I can, of course, add new items from the bottom menu using Save and New. So I can go ahead and add something like paracetamol. Compucare will do the same thing and pull through all the detail for me. When I'm happy, I can hit Save from the bottom. Now, back on our full prescription, you'll see that further down, we can see the individual items that we've just added listed out, including their quantity, dosage description, and notes, as well as our personal notes if we'd recorded any. Now, I do have the option to edit these individual lines, delete them if I've added them in error, or add other lines as well. On the right, we'll get those details again underneath individual items. So you can see our amitriptyline at the top, and we can scroll down and review all those. And we have a little option to switch to the next record at the bottom. So I can go ahead and switch across to my paracetamol and review that as well. Otherwise, when I'm happy, I'm ready to dispense, I can hit the save button from the bottom. Now, Compucare is going to go ahead and prompt me to just check that I've read through everything here. And when I'm happy, I can get the option to save again. Now, Compucare is going to then go ahead and save our record. And in the background, Compucare is going to do all of that hard work for you. It's going to create a booking, an associated episode of care, and it's going to handle the charges too. Previous to this, you'd have to manually make that booking yourself and the episode of care and the prescription record to go with it. Compucare is going to automate that process for us, utilizing the defaults for pharmacy walk-ins in the scheduling settings app, which I can set up to always use a specific room, purchase a contract and source for the booking it's creating in the background. Now, with our post actions on screen, we have the option to dispense. If all items can be dispensed, there is some control in here if expiries need to be filled in too. Otherwise, when I'm happy, I can hit the dispense action for me. Now, when Compucare's filled that for me, you'll see the next two post actions come alight, which is bill and post, so that we can even bill from this screen as well. Now, I'm not going to do that today. I'm just going to hit finish. Back in the app, you'll see our two individual items listed out, amitriptyline and paracetamol, which I can again use the print function from the top if I want to print out with my clinician's signature. Otherwise, that's the full dispense app, which as a recap is just a streamlined app for your pharmacist to quickly fill out new prescriptions and dispense medication to your patients. This will be useful for when the patient's received a paper prescription and where the associated pharmacy charges aren't going to be associated back with an outpatient booking and where the pharmacy are able to bill the patient. It's also going to be useful for any prescriptions not delivered via e-prescribing done as part of the patient's consultation process. Now, those are our pharmacy user stories. We have some more coming in future versions of Compucare, but we're hopeful that with those amendments, you can see how we're keen to build better processes through Compucare in this part of the system. Now, for the next section of user stories, I'm going to mainly be talking about the orders module. Now, we've made a lot of improvements to this part of the system recently, a lot of which we discussed in our last webinar, in which we walked through the patient journey with a lot of the new RIS features. Here, we've built on those features to further your efficiencies with Compucare as a RIS. Now, the first of these changes that we're going to look at is in the scheduler screen, which I've got on screen. Now, we know that users looking to schedule and make bookings for orders will sometimes have two screens open for Compucare, one with the scheduler app like I've got and another with the orders app. And when you come to schedule requested orders in the Orders app, it utilizes our next free feature, which has been designed to show you the next available slot for your patient's booking. On the other screen, you'd have the Scheduler app to cross-reference what existing bookings are taking place on the day. So let's say, for example, we're looking to book an MRI knee for a new patient, and we would want to know, after finding this big free gap at 2 o'clock, what other MRIs are taking place on the day. Now, we can see this big gap. We want to know what's happening with these 4 bookings. Prior to this change, users would have to open each individual booking to see the orders taking place. Now, if I hover over any of the bookings, you can see in the detail that shows we get the individual scan taking place, so my 2 MRI knees. Further down, I get my MRI brains. Now, of course, I can also select one of these bookings, let the reading pane load, and further down, you can see the order details in here as well. Now, this small addition to the Scheduler app, which of course works on multiple resource mode, I'm only on single resource mode for now, is going to help your users book that right slot. We know that understanding your clinics at a glance is going to help limit same type scans from being consecutively booked, potentially causing RSI for your sonographers. Or on the flip side, maybe this visibility will help group similar exams together, such as our MRI knees, which is going to help minimize equipment adjustments. As you can see, I can now easily spot my MRI brains versus my MRI knees, so I can appropriately book my next patient. We're hopeful that this will simplify the scheduling process by reducing the need to switch between screens or open up bookings, and we're hopeful that this will help ensure compliance with specific booking rules for ultrasounds and MRIs. What I'm going to do for this next development is I'm going to go ahead and I'm going to create a booking for our patient. So I'm going to book that MRI knee by selecting my two of my slots and doing a new outpatient. Now, I only need a basic booking for today, so I'm just going to quickly fill out my patient. I'm going to select their episode of care, and mark that it's not a follow-up, and I'm going to go to the Add Orders menu, which is where the next change is. So we have a new field in here. If I just select my service request, underneath that, we've got a priority field. So this field is intended for those of you making orders through Compucare to put a priority to the order, which can then be used to populate and match the priority found in your PAC system. Now, keep in mind, this is going to be hidden by default, and it can be enabled under the cog menu at the top under Edit Layout. Now, I've got 4 options in my priority menu: clinically urgent, routine, stat, and urgent. I'm going to choose urgent for today, and I'm going to show you in a moment where that list is pulling from. But you can see we've also got some colors in here to help indicate that priority too. I can also then go ahead and fill out things like my clinical notes and my booking instructions. But keep in mind, of course, I'm not following the usual vetting and documenting process today just to get to this stage, and that those fields will be filled out differently by your RAD team during vetting, but I'm quickly completing this for demonstration purposes. So I'll fill out my notes and I'll hit save. That'll attach itself to the booking, and I'll save the booking. Now, when that's saved, I'm going to switch over to our Orders app, and I can show you how that then looks. So in here, we've got our patient with an MRI knee left. And in here, you can see I've got my filter preset to show me my urgent priority scans. I've also got the priority here on my reading pane as well. So if I wanted to skip through my orders, I can see this one's also an urgent above it. Now, keep in mind that this priority field will also need to be set up in your grid and your reading pane. So if I drop my filters back, you'll see it's here in the grid as well. If you're using it for the first time, and this field can also be used in saved filters and tiles on the home menu. Now, if I drop off my priority just so I can see everything, I'll show you the full list of orders I've got for the day. So you can see I've got my routines in here as well, and I can, of course, order this column accordingly. Now, keep in mind, I can clearly now see all of my priorities, order the grid accordingly. And if I were to look at scheduling my exams according to priority, I could quickly and easily see those things like urgents or clinically urgents, for example. Now, to facilitate this change, we do have a new code table called Order Priorities. In here, you can see the 4 I've got set up. And if I edit one of them, you can see we've also got the color selection as well. So we can choose a corresponding color for this order priority. And that can then pull through, of course, to the Orders app. Now, keep in mind, those of you utilizing a PAC system, that we can populate HL7 integration messages with this order priority 2 to keep the systems in sync. And also, this feature is not to be confused with urgent reporting requirements. This is more for the scheduling process for those exams that need to be squeezed in. Our goal here was to make it so that the Compucare system and PACs can stay in sync and reduce the need for users to have to cross-reference both systems. Now, our next addition to Compucare is around the accept process for orders. See, at the bottom here, we've got 3-part MRI spine for one of our patients, all linked together, and you can see it's sitting at the requested stage. It's waiting to be vetted and accepted. Now, given that the logic here is that all 3 parts will be done in the same appointment, now when you click the accept button, you can accept them all at the same time. Previous to this, you'd have to select them all individually per scan. But now we get the option to either select the one that we've already got selected behind, or we have the option in the middle to accept all of our linked orders. We can still just select the one if the other 2 aren't justified for any particular reason. I'm going to go ahead and accept all my linked orders. Compucare is then going to go ahead and switch them all to the status of accepted for me, so we can action them all at the same time. This change is hopefully going to speed up that and streamline that process for multiple scans on the same booking, and it does utilize our linked orders feature. So now our 3-part MRI can be actioned together rather than separately. It hopefully will free up some users' time. Now, sticking with orders still, our next addition to Compucare relates to the process after the patient has been seen and scanned. You'll see here at the top, we've got one of our patients sitting with an ultrasound abdomen at the awaiting reporting stage. They've had their ultrasound, and our reporter is now ready to interpret the images taken during the scan. So if I go to Add Report Internal from the top menu, this change that I'm going to talk about has been made for those of you reporting internally within Compucare as a RIS system. What we have found is that those reporters writing out the report based on the images they're interpreting will occasionally need to flag up this report for urgent or follow-on actions. Perhaps the scan has shown something like cancer, or maybe a tumour, or maybe it's a positive scan for something like deep vein thrombosis. Anything that's going to make the hospital want to contact that referrer urgently, be it an NHS GP or a hospital consultant, or maybe it's just to make admin staff aware that the patient needs another scan in a month's time to check the growth of the tumour. What we've done is we've provided a way within Compucare of highlighting that this report needs to be reviewed or flagged for follow-on actions through the use of tags here in the reading pane. Now, tags are used throughout Compucare for users to dynamically tag records across the system, from things like bookings through to episode of care, all the way through to billing, basically to make other users aware of things. Now, these can also be used for custom filtering as well as report purposes. So I can appropriately tag my order with something like urgent cancer. And once I've saved this, I'll be able to then filter my order screen according to those tags in this menu here. And you'll see it'll drop down to just that one record. Now we can, of course, utilize, say, filters or maybe tiles on the home screen, which will pop up with a number indicating how many records have this tag at any one time. Now, we're hopeful that this change will help those of you using Compucare as a RIS and will further enhance your ability to action patient reports. Now, with the addition of tags, we also wanted to give those of you reporting on Compucare within Compucare the option to view and add notes about the scan whilst you're in that order report internal screen. So if I go ahead and edit the report internal, because I've already saved it now, you now have in here the orders notepad found in this quick action menu, which can be used whilst the report has been written to write new notes about the scan or the results, or review previous notes on the order. So I can see these two notes added previously. This is perhaps going to better help the reporter understand the context and the history of the scan, or maybe it's going to add be an option to add further detail regarding our tag. Now, if I go back out of here for a moment, this is the same order notepad that can be found here in this menu, which exists throughout the life cycle of this order. All we've done is we've extended that option to within the order report screen. And again, it can be used for fully recording any notes against the order. All we've done is extend the option. Now, next up, a small change that we've made to orders that I'm going to show you through the patient area. Against this patient, I have a cancelled booking from earlier in the week. You can see this one on from the 5th at 3 o'clock. And if I scroll down on the right, you can see it's been rescheduled by the patient. Now, the change we've made here, if I go to the Orders app and try and make a new order, is Compucare used to allow you to select that cancelled booking, either DNA'd or cancelled otherwise. So, for example, if I was creating a new MRI scan for this patient, I could select my cancelled booking and I'd run into all sorts of issues. Now, you can see the 5th is not listed in my long list of bookings for this patient. Compucare is no longer going to show cancelled or DNA'd appointments in this list, giving users a little bit of safety when they're making orders. Now, I'm not going to create that order today, and I'm going to switch back to our Outpatients app. Still sticking with our patient, although, of course, all these changes also work in the home area. We've also improved Compucare's handling of orders when the booking gets cancelled. So I've got an appointment here for the 8th. If I go and show you the orders against it, you can see they've got a full blood count sitting at the status of appointment scheduled. So it's still waiting to go ahead. Now, previously, if I went ahead and cancelled this booking, the clinic's been cancelled, then the order would effectively get unlinked from the booking, or it used to get unlinked from the booking, allowing it to then be rescheduled. If I go ahead and cancel this booking now, so for example, again, using that clinic cancelled outcome, it's going to fill out my outcome as well and hit save. Now, when we get the little post actions, we're going to be able to reschedule our booking. Now, again, Compucare used to unlink the two, but if I go ahead and hit the reschedule post action, you'll see on the new booking window that opens up that the order down here is going to reattach itself to the new booking. It's going to automatically pull through to save staff from having to manually re-edit every time. Now, I'm not going to do that now. I'm going to just hit finish and not reschedule that booking. If staff do miss that post action, there is the option under the edit menu as well. Now, you can still see that this booking is still cancelled. And if I go to the order associated with it, that full blood count, you'll see that the status is now back at requested. It's no longer scheduled. Now, similarly, as part of this change, we've also improved the revert booking functionality. So leaving our booking cancelled on that order awaiting scheduling, back in Outpatients, if I were to go ahead and revert our cancelled appointment, let's say it's no longer been cancelled, previously the order would have still been separated from the booking. So staff would have to open up the booking and then reselect the order. Now, when we revert a cancelled booking to a state of not cancelled, where an order or orders had previously been unlinked by that cancel action, the order or orders will automatically reattach itself to the booking. So if I go back now that it's not cancelled, you'll see that my full blood count has now gone back to the status of appointment scheduled. So we're hopeful with those improvements around rescheduling and reverting, your orders process will be greatly improved. Our goal here was to improve efficiency in Compucare, and we hope that all of these enhancements to orders, including those covered in our previous webinars, will allow your hospital or clinic to use Compucare as a RIS and benefit from that streamlining that we've built into it. Okay. Now, the final user story I wanted to cover today before handing you over to my colleague Jacob is a small change to outpatients and inpatients. Now, prior to this work, we developed a deferment reason field against bookings, which can be set up to be a mandatory requirement for bookings taking place more than the specified number of days that on an episode of care's referral date in the case of outpatients, or the decision to admit date in the case of inpatients. Now, these are set up in your episode of care sources, and they're going to be useful for hospitals monitoring KPIs around appointments meeting requirements. Now, I've got a booking here on screen for the 6th at 1 p.m. Now you can see the change we've made here on the right is the deferment reason is now visible in our reading pane. Previously, it wasn't visible here. Once the deferment reason had been chosen when the booking was scheduled, users wouldn't then be able to see it again. So we've added it to the reading pane, and if I edit the booking as well, I will also get the option to review it in here too. So if I need to change it for any particular reason. Now, keep in mind, of course, it's mandatory against the episode of care source just because of the date that this booking's taking place. You can see I can change this in here or review it as needed. And this will also be visible in the complete booking screen too. Now, it won't show in the reading pane or in those screens if it hasn't been filled in, if it's not applicable. And keep in mind that this functionality, of course, also exists in the inpatient bookings app too. Our goal here was to make this element of the bookings process a little bit more visible for users. Thank you. And I'm going to hand you over to Jacob.
Thank you for that, Jonah. I'm just going to start by providing an overview of one of our newer functionalities, automated rules. You may not be familiar with automated rules, but automated rules are triggers within Compucare that send forms and notifications to the patient. The automated rules can save a hospital a large amount of admin time, reducing the need to manually send notifications and forms. Examples of how automated rules can be used is sending an invite to the patient portal based on booking creation, or alternatively, a satisfaction form that can be sent to the patient once an appointment is completed. Today, I'm going to be showing you some of our new features regarding waiting lists for automated rules. The first enhancement I just wanted to show you in automated rules is how we can create a rule to send a notification to a patient when they've been added to a waiting list. So as you can see, we're in the automated rules code table, and I've just opened up my waiting list cataract surgery consultation. On the right-hand side, we have our rule type of waiting list, and then we have our action type of send notification with waiting list SMS template. You can see here we can filter on when the automated rule is triggered with our rule criteria. In this case, I've just used the waiting list cataract surgery initial consultation. And finally, we have our letter template, which is waiting list notification. This is the template that will be sent to the patient when this automated rule is triggered. I'm just going to show you an example of what this may look like. So I'm just pulling up an email here. As you can see, this just pulls through the cataract surgery initial consultation, and then just gives the patient a prompt to either sign up or log into the patient portal to book an appointment from this waiting list. As you can see, we've got the link here. This will make a little bit more sense in a moment. Leading on from this user story, I'll be showing you how patients can book appointments from waiting lists on our portal. This requires a small amount of setup, so I'm just going to go ahead and show you how this is set up in the automated rules. I'm just going to open up a rule I've already got for this for outpatient waiting list cataract right eye. So as you can see again, we have our rule type for waiting list, and we have our action type of launch config in outpatient next 3. Again, we have our rule criteria where I've just filtered again on our cataract surgery. And we have our configuration of right eye cataract. This will make a little bit more sense with configurations a little bit down the line. This is important for setup for if we wanted to, if patients wanted to book off waiting lists on the patient portal. So there is a little bit more setup for this. So I'm just going to go ahead and go to the waiting list code table. And then I'm going to open up our waiting list that we've been speaking about. As you can see here, we have our show in patient portal toggle. So this will be toggled to no in your system. So you'll just need to toggle this no for the specific waiting list you want to use. And you can also use an alias if you wanted to use a different name in the patient portal if required. So the final bit of setup for this is in the patient portal settings. So I'll just go ahead and go to the patient portal settings now. And then I'll select online bookings. As you can see here, we have this option for enable online bookings. This will be toggled to no again in your system, so this just needs to be toggled to yes. So I'll just show you what the workflow may look like in the patient portal. So I'll just go ahead and go there now. So from the home screen, we can go to the Bookings tab, and then we just have this new prompt that we've been added to a waiting list of cataract surgery initial consultation. The patient will be prompted on the next available appointment with a clinician. If they're happy with this, they can just go ahead and select book this appointment. However, if this time doesn't suit, they can go ahead and select other dates and times where they can select this here for a more suitable time. Going back to Compucare and automated rules, I'm now going to show you another enhancement regarding waiting lists. This enhancement allows the ability to launch a surgical next-free configuration for waiting list entries. So before going into an example of the workflow of the functionality, let's have a look at the setup in automated rules. I'm just going to go ahead and open a cataract removal surgery automated rule. And familiar, we have our rule type of waiting list. We have our action type of launch config in surgical next free. And again, we have our waiting list of cataract surgery with our configuration that we've previously mentioned, which will make more sense in a moment. So I'll just show you what this will look like in the waiting list entries. I'll just filter on our cataract surgery waiting list, as you can see here. So providing the filters against the automated rule match that of the waiting list entry, you'll just get this line in bold at the top of the screen. So I'll go ahead and open that. You can see this is just our automated rule that we've just had a look at. And what this will do is just open up the Surgical Next Free app. On the right-hand side, we can see this configuration that we mentioned against the automated rule. And what this will do is just pre-populate some of these fields. So in this example, we've obviously got the surgeon, Dr. Hollington, we've got the site, got this procedure and specialty. If we wanted to change the configuration, we could just add a new configuration here and then just add that against the automated rule. But for this example, I'm just going to use Dr. Hollington. And then as you can see, we can just select finish. I'm not going to go through this process as you're probably already familiar with this, but you can obviously book into an appointment here for a surgical booking. And you can see how this can streamline operations with the ability to just pre-filter on some of these surgical booking selections. So we can just save on admin time here. As much as the automated rules are very useful for automating sending patient notifications, we are aware that not all patients want to receive updates such as when they've been added to a waiting list. So we've provided the option for patients to be opted out of the automated notifications. The key reason for the enhancement is to allow patients to have more of a choice on whether they receive automated notifications. So if I just jump to the patient area and then edit my patient, as you can see here, we have our opt out of receiving automated notifications. When toggled to yes, a patient won't receive an automated message that hasn't had user intervention. However, there is a caveat to this whereby we can override this opt-out setting in the automated rules. So I'll just show you how this may work. I'll just go back to automated rules and then select booking cancelled. As you can see on the right-hand side, we have this rule overrides patient opt-out setting. So when toggled to yes, the notification against this automated rule will send to the patient regardless of their opt-out setting. So as you can imagine, this would be useful for if a booking has been cancelled, because we do need to let the patient know this. This rule overrides patient opt-out setting toggle is only available for automated rules that send a notification. So if, for example, I just change this to waiting list, you can just see that toggle disappears. I also just wanted to show you how we've made changes to adding notes to form components that can then pull through to waiting list entries. Previously, notes wouldn't have pulled through from the form, which resulted in the repetition of adding notes to the waiting list entry. So if I just jump to my clinician in the person area, and then just to clinician's view. As you can see, we have our outpatient booking here, so I'm just going to select play on that. And what this will do is just open up a default form from the clinician. So for example, the clinician has seen the patient and decided that the patient needs a knee replacement of some sort. The clinician has also decided that prior to the appointment, then the patient will have to see a physiotherapist, So I'll just select this and add a waiting list note. And then I'm just going to fill it in these mandatory fields with just test data. Just going to add an outcome of requires inpatient booking. And as you can see, what that does is just add another new waiting list note on the right-hand side. So I'll just input a note in here. And then I'll just add a planned procedure here. Add my procedure site, which is obviously knee. And then I'll add my laterality of left. So what this will do is add the patient to 2 waiting lists. So the first of which being the physiotherapy waiting list, just from this form component we see here. And then from the outcome of requires inpatient booking, that'll just add the patient to the requires inpatient booking waiting list. So I'll just select save on that. And I'll select finish. I'll just show you what this may look like in the waiting list entries app. And I'll just filter on physio and inpatient bookings. And as you can see, we have our 2 waiting list entries that we've just inputted. So we have our previously absent note from the inpatient booking required waiting list. And also we have the planned procedure here. We have the same for this as well with the note. This just stops admin staff having to put this note in again. So just saving on admin time again. Now I just wanted to go through some enhancements we have made to the patient portal. The next enhancement allows you to customize the guidance text presented for online forms in the patient portal. Previously, this was hard-coded in the system. The enhancement continues our goal to improve customizability in the patient portal so that every client can cater their patient portal to their needs. So I'll just go across to the patient portal settings and then just to online forms. And as you can see, we have our form guidance text here. So previously this was grayed out and couldn't be altered, but now we can just alter that. So I'm just going to input some more appropriate text here and then just select apply. I'll just head over to the patient portal and just show you what this may look like. I'll just go to forms and then edit my form. And as you can see here, we just have this updated form. I also just wanted to show you how guests may make a deposit after confirming a booking in the patient portal. The key driver for the enhancement is to allow patients the option to confirm and pay their deposit without the need to sign up, creating more opportunity for new patients at the hospital. So I'm just going to jump back to Compucare and then to my patient. And then you can see here, we just have an outpatient booking. So I'm just going to select send notification here. And I'm just going to input my template of appointment confirm SMS. As you can see, this just gives the patient a prompt that they need to confirm attendance and pay the deposit for their booking. You can see this just has a link here. So once this is sent to the patient, I'll just show you what this may look like when the patient opens this up. So you can see here we have the details of the appointment and the ability to either view my booking or confirm attendance. So as you can imagine, confirming attendance seriously reduces the chances of a DNA for an appointment, which is obviously very helpful for hospitals. So we'll just confirm attendance. As you can see here, we just get that prompt to pay deposit of £50, and then you can just have a look at the terms and conditions and then just select pay now whenever ready. I won't go through this process because this just takes you through to the PXPI frame, and I'll go into a little bit more detail about this later on. I would like to now show you another enhancement regarding funding sources. Previously, patients could only book appointments through the portal via self-pay. We have now increased the functionality to add a funding source selection when a patient is making an online booking within the patient portal, now allowing for insured bookings. For a purchaser to be selectable in the patient portal, we need to go through some setup in Compucare. So I'll just go to my purchaser. In this example, I'll just use a self-pay purchaser. So as you can see here, we have the patient portal online bookings configuration. So the purchaser is online bookable. As you can imagine, this needs to be toggled to yes. We have our show quotation prices. So what this will do is show the patient an estimate of their consultation in the patient portal. And finally, we have our alias, which I've inputted as self-funding. So this will just be what shows in the patient portal rather than this self-pay name we have in Compucare. So there's a little bit more setup for this. So I'm just going to go to the patient portal settings and then online bookings. As you can see here, we have this allow funding source selection. So when toggled to yes, this will just allow the patient to select their funding source in the patient portal. We also have an enhancement for having purchaser prices per clinician. So I'll just show you what this may look like. I'll just head to the person area and then my clinician. As you can see, I've already edited the clinician, so I'll just go across to the clinicians tab. And as you can see here, we have this option for online booking purchaser prices. So I'll just select plus on this. I'll just add our self-pay purchaser. And then we have some purchaser price types to select from. So as per contract, that will pull from the contract in Compucare. Hidden from patient will hide the functionality completely from the patient in patient portal. And then finally, we have the option to specify override where we can manually input our prices. So I'll just use that as an example today. So I'll just put £100 for the first appointment and then £80 for a follow-up appointment price. I'll add that and select save. And I'll finish on that. I'll show you what this workflow looks like in the patient portal. So I'll just head to the bookings tab and then select make a booking. Sorry, there might have been a bit of an issue with the setup. So I'll just go back to the patient portal settings. I might not have applied this. So I'll allow patient creation, funding source. Okay. Go back to the patient portal. I'll change this. Okay, so we have our funding source here. So we can select, for example, Bupa Limited. And this gives us a validation just to add an insurance membership number and authorization code. If we try to view appointments without this, as you can see here, we just we get this validation where the patient will just need to input something here. We'll just use self-funding, and then we'll select view appointments because there's no validation required here. As you can see on the left-hand side, we can filter on treatment, clinician, site, and date. And then we can just change the funding source if required, but we'll just use self-funding for this case. As you can see here, we have our Dr. Roger Wilson. We've inputted our prices in Compucare, if you'll remember. So as you can see, we have £100 for a new appointment and then £80 for a follow-up. So I'll just select this appointment here. As you can see, again, we're just prompted that this is £100. And normally we'd have the PXP iframe just to for the patient to register their card here, but it might be something in our setup. So I can go through this in a separate video. But for now, this is just asking us to request an appointment. But normally we would just input our card details here. So we have that on file, and then we'd just accept the terms and conditions. So another user story I wanted to show you is in the bookings tab in patient portal, and it's to do with our multi-bookings. Previously, it wasn't clear that a booking was a multi-booking, so we've made provisions to make this visually much clearer. So as you can see here, I have a multi-booking, and you can just see this bright tag that just makes it more obvious for the patient that this is a multi-booking. And we can select view booking, and we get a breakdown of each appointment. The final user story I just wanted to show you before handing back over to Mark is how we've changed our verification layouts in the patient portal sign-up process. Previously, patients were able to sign up to the portal without having to verify their email. This created issues whereby patients were calling the hospital and users were having to remove patient portal registrations due to the fact that the patient had signed up with the wrong email, increasing admin time for the hospital. The added enhancement of verifying an email reduces the chances of a wrong email being inputted and ensures the patient can receive notifications. So if I just jump out of the patient portal and show you what this may look like, and then select login and sign up, and then select sign up, I'll just input an email address here and select send verification code. As you can see, if for whatever reason the patient doesn't receive the verification code, they can select the send new code. or alternatively, they can input the verification code they receive via email. Once this has been verified correctly, the patient can then go ahead and select their new password and confirm their password. And then they can move on with the rest of the creation of their patient portal account. So that was pretty much all I wanted to show you in the patient portal. So I'll just hand you back to Mark.
Great. Thanks very much, Jacob. So I'm just going to run us through some final slides before we finish, because I'm worried that we're just about at 11 o'clock. So the first thing I wanted to show you was around the patient portal that Jacob's just kind of spoke about. So in 878, we're going to be releasing a new user interface for the patient portal. So we're going to slowly release this in. So from 878, you'll have the ability to toggle on the new UI from this build, and then we'll give it a few builds, and then we'll probably take that toggle away to make sure people are all using the same one. So the reason we're doing this is to link in with best practice, similar to your other kind of day-to-day apps, things such as like banking apps. We find it has this more refined layout behind it. So we're hoping to be consistent with those other types of apps, which a user should already be used to. So another reason we've done this is down to kind of future functionality that we will be releasing. So we're hoping to be releasing things such as order results towards the patient portal. So with releasing this as well, we found that the grid approach that you've just kind of seen Jacob walk through, it didn't quite cater for these future enhancements. So we needed a more kind of streamlined look about it. So the new approach we've taken also gives the patient more of a to-do list style of portal. So on the home page, they'll see that they have kind of the next to-do item. For example, if we need them to make a booking, it will give them hints at things like that. So if I just flick through some of the screenshots on the screen here, you can see what it's going to look like. So you can see there the little blue box that gives them their next item. So they're on a waiting list and they need to make an appointment. So it just shows them what they need to do next and hints at those sort of things. So we are adding a few other enhancements as well as we make this UI change. So this includes the ability to now see letters attached to a booking. The patient will find this helpful to see any appointment confirmation messaging, as well as any kind of pre-appointment information they may need to action, such as for inpatient bookings. This may be pre-surgical information, for example. So you can see in the middle of the screens there where it says your messages in the booking screen, it just shows them everything that's attached to those messages. So I'll just show you a few of the other screens. We will be doing a more in-depth dive of this at some point, but you can see the transaction screen on the screen there. And that's kind of going to be releasing, like I said, towards 878. So it's worth keeping an eye out for that. And we will release more information about that as well. So just to end today, please do keep up with our release notes. We've not showed you everything today. We've showed you most of the new enhancements, but you will see there's a little video icon on our release notes where you can watch any specific user story and how the developers kind of release that. So make sure you stay up to date with Compucare as well via YouTube, LinkedIn and blog content via our website. Please do get in touch about anything that you might need to know. I've just put the marketing details on the bottom of the screen there. And finally, we do just have a poll that Holly's going to send out. So you should see this pop up on your screens. If you can fill this out for us, it just gives us some feedback about how useful you found today's webinar and anything that we can improve as well. So please do fill that in for us to give us some more feedback. Thank you for joining today's webinar, and we'll see you at the next one.